legalizing recreational marijuana use, it is imperative that we provide a strong and positive and solid message voice, unified. Education and prevention do work, and they yield positive results. We know that community involvement across all 12 broad-based sectors and communities provide a powerful platform for information, messaging, strategies, and activities.
Happening when they get to high school. We have to change the culture of the acceptance around marijuana. The anti-tobacco efforts are really the quintessential example of success of environmental strategies in reducing the substance use. The culture of tobacco use in communities changed as a result of youth receiving greater education on the dangers of tobacco, advocacy leading to smoke-free environments, taxes and increased compliance checks, making access to tobacco more difficult, and strong marketing strategies countering big tobacco. Effective environmental strategies have made tobacco taboo, eventually made tobacco non-existent in the lives of kids growing up in the 2000s. In 2000, 23% of our teens smoked nicotine, smoked cigarettes. That number now is around 6%. So I can say this to you. We have a challenge in front of us, but we've been there before, and we can do something about it. Environmental strategies start with awareness and education. Reading through the myths is a great educational start. So let's get the truth out there about marijuana and really teach the community what drugs are all about. Our children now are challenged as never before. And it's going to be up to us to try to educate our kids on the front end, making sure we can help the people who are in the middle right now, whether they've gone to progress, whether it be alcohol or marijuana, to our opiate problem that we're dealing with right now.
Years. Just this month, the Commonwealth Fund, a very learned global body, produced a report on deaths of despair. They call it deaths of despair. And it's not just opioids, of course, but it's the hidden issues of alcohol, suicide, which are on the increase, and most worryingly of all, on the increase in young people. The US now leads the world in drug policy reform. You wouldn't have imagined that just 2 decades ago. That's not my comment, that's the comment of the United Nations. So these policies have an impact, you know. And what I'm very conscious of, and with great humility, I recognise that healthcare alone cannot create health. When you think about the pathways, when you think amongst yourselves about what makes you healthy, the people who are walking around this mall this morning, it isn't necessarily a visit to a doctor or a therapist. It is other life conditions that make us healthy. And marketing has a key impact on our health. You know that. We don't just face the old challenges, we face new challenges too. So the public discourse around this is confused, and it's made more confused by the heightened problems that we have in terms of discourse more generally. Being informed, and the great thing I've learned about working with young people is that they can work out when you're telling them lies. So we better be saying the truth and be backing the truth up with ways of helping. Family involvement is key, regardless of the makeup of the involvement. Strong peer support. We know a lot about the brain. We know a lot about the brain in early life. One of my teams in my organisation works with children from 0 to 3-year-olds. Some of the most disabled children on the South Shore, children on ventilators, children living with developmental delay. And the reason why they work, where they do their teaching, their speech and language therapy, their social work, their therapy, their doctoring, all of those disciplines are within our team that works with 0 to 3-year-olds, is the brain is very malleable at that time. If you looked at a graph and you looked at the x-axis being time, chronological age from 0 to death, and the y-axis being malleability or growth, brain growth, not just educational growth, but ability to make good decisions, there'd be a steep curve in those early years. It would plateau a bit, and then in adolescence, another growth. And that's why Barbara says delay, delay. That's why that message is right. Because if can enable young people to get through their brain growth, then they will make better decisions moving forward.
And I think that really this, we have a long-standing tradition here of trying to be on the cutting edge of education as well as enforcement. Because we understand, as part of our mission, that education is just as important as enforcement. We believe in attempting to work with our partners to address quality of life issues. And I think that those are the types of things that all the speakers that have been forward this morning prior to me have really talked about things that are quality of life issues both in our own families and quality of life issues in our communities.
You will see as you go through the display this year that there's more emphasis on what the actual laws are for the Commonwealth, especially so that parents can be well educated to help their youth.
Yeah, you sure? Okay.
A photograph like this is
1, 2, 3. Picture.
well, I'm delighted to
Go for it. Snip it. Prove they can.
So, so the thing is, the cartridge basically is $4 a cartridge. Come in different flavors. So this one I think is mango. Yeah, it's $4. Well, because they're not FDA regulated yet. It is nicotine.
Yeah.
For a pack, and this is equal to a pack of cigarettes. This little cartridge is equal to a pack of cigarettes.
Yeah.
So it's $4 versus a pack of cigarettes. Correct, because it's not FDA regulated, so there's no taxes on it right now, and it's not going to be FDA regulated until 2022. Correct.
Yeah.
And most of the packages on the front it'll say no nicotine, but when you turn it over, it's like nicotine. So there is nicotine in there, so it'll be the same type of thing. And the buoy is here because federally it's still illegal. So if you are in open waters, if you have a boating accident, if something happens, and the Coast Guard has to come and assist you, there is a detention. And with it being recreationally legal in Massachusetts, they would prosecute you in federal court because it's federally illegal. If you were off New Hampshire waters, you would go into New Hampshire state court districts, but Maine and Massachusetts, it would be federal court. And Rhode Island, I think it's still state court. So it's just, you know, and so many of our young people, they grow up around boats, and it's just kind of a rite of passage to let them off of the boats, go out for the day, you know,